Over 17 years of SNP government, the problems in our NHS have mounted up. Burnt-out staff, lengthening patient waits, and recruitment and retention, to name just a few. Yet the government have time and time again failed to realise that for many of these challenges, more money is not the only answer. It's not good enough to blame Westminster for the state of Scotland's NHS. The big challenges facing our health service are the SNP's responsibility and won't be resolved simply by more funding. Because firstly, we will run out of money. And from the SNP government's perspective, they've already hit that point. The IFS have said that health spending in Scotland is due to fall in real terms next year, and major capital works like hospital upgrades have been paused for the next 2 years. Let us be very clear. Cutting health spending in Scotland is a political choice made by the SNP. And stopping the NHS from investing for its future is short-termism in the extreme. Now, part of that will be the most common way that people interact with the health service, through GP appointments. Yet the share of the budget allocated to GP services has declined. We've seen 86 local medical facilities being closed since 2012 as part of a centralisation agenda. As a bare minimum, people expect to be able to see a GP in a manner that is convenient to them. That's why we would increase the proportion of NHS funding being given to GP services. This would enable us to recruit 1,000 additional GPs across Scotland. We'd also introduce a ban on local health closures for reopening practices to ensure there are no black spots across the country. We'd make appointments as accessible as possible by offering online booking and consultations, and introduce a new national standard of 1 week for waits for a GP appointment, so that the unacceptable waits that we have seen become a thing of the past. Taken together, our GP guarantee would reduce pressures in our A&E departments by restoring confidence in local health services. Yet, raising capacity cannot just come from increased investment in services. We need to look at making the NHS more efficient. In our paper, we look at how we can save money through better workforce planning to reduce the £500 million of agency staff bills.